Good morning, PSPD. This is Dr. Chris Lugo talking to you post-Turkey Day. Well, I'd like to say my Turkey Day was super enjoyable, but like most people, I was chewing on something I shouldn't have chewed on, and I'm back in my mouth, broke. So, like some of your kids, I am going to have to get my tooth fixed with a amazing crown. And I thought today would be a great way to sort of introduce that because a lot of parents have questions about what a stainless steel crown is and what a kid's crown or tooth on a baby tooth crown is like. So basically, what we're dealing with is a tooth that has enough decay or damage that you can't restore it with simple tooth colored filling. That means that there's not enough tooth for us to actually stick filling on. You shoot it on there and try to stick it on. If it's broken down too much, there's not really a good way to make the filling last. So the recommended course of treatment would be for us to put a full coverage restoration on it. Now that being said, a full coverage restoration there's a couple options, but the one that we've been using for literally about 50 years, 60 years, and probably longer is this little guy. Looks just like this. It is a Pediatric stainless steel crown. And the reason why we use these crowns is a couple reasons. One is that in a kid's mouth, they are designed to be flexible because children are growing. It's also a very easy thing to put directly onto the tooth and cover it and protect it. Is it ugly? Yeah, it's super ugly. It's not ideal. Back in the day when we had amalgam fillings and those were going in for everyone, we're doing alloys and we're doing other, let's say, not such pretty materials, these were huge. They were the only option we had, and still to this day are pretty much a very highly recommended treatment choice. There has been a big push in the market for these little tiny zirconium crowns, which are starting to become pretty popular, but we have had experience with them that have not been favorable. So we are still trying to work out the kinks before we can offer it to our patients, because if we're going to do something that's going to be more expensive and cosmetic, we want to make sure that it's going to last. It's not going to just be a waste of your money. So that being said, the stainless steel crown is made of surgical stainless steel. It's the stuff we used to make hips out of or any kind of replacement joints. And now we basically have formed it into tooth material. So basically internally, I can show you inside, we have a little tiny gap inside that you can just stick right on top of the tooth. I'll do it on my finger right here. Boop. Like that. So you prepare the tooth, remove the decay, the damage, and then you just slop it on. Push it on really hard with some cement. It sticks, and that's it. We're done. Depending on how easy it is to fit and how much decay and how the kids are doing, they're pretty fast. They can be done under, in my hands, a couple minutes, but in some of our providers it may take as long as 20 minutes to get on there, just depending on how much tooth we're working with. Additionally, we can talk a little bit about what you do inside the tooth, but I think today I was just going to focus on the crown because I get to go get one of those. Not going to be stainless steel. I'm actually going to probably get gold because it's a really good alloy on the back teeth. It's designed to be flexible like this. The reason why we talk about flexibility is primarily because kids are growing, and the growth that occurs in their mouth will change their bite, and we don't want to put something in there that's too hard that will start to hurt as you bite down. It's like when you get a filling done that doesn't sit just right, and it starts to cause some pain on that tooth. Basically, that can happen in a kid's mouth as well, so the stainless steel provides us an option that is a little bit more flexible. Total coverage, it's made of steel. It's pretty hard. You can really beat it up and eventually the tooth will fall out. So we always look at it from that perspective, that this is not something that's permanent in your child's mouth. But they're ugly, they're not pretty. But when it comes down to it, they're in the back. Most parents won't necessarily see a ton of these going on. And we try to be very conservative before we place these crowns. But when we're dealing with a kid who's 2 years old, who has a lot of decay in their mouth, these are pretty much they're the gold standard, no pun intended, of what we want to do in terms of trying to protect those back teeth. So that being said, I just want to go over some things, especially not to chew on stuff like, let's say, hard candy. It will break your tooth. And also, if we do discuss stainless steel crowns with you guys, this is pretty much the last option we have. So we're coming up with, we're trying our best to try to save this kid's tooth. So just so you know what's going on, I want to wish you guys a happy after Thanksgiving, and I look forward to seeing you guys before the holidays. And please remember that the holidays fill up quick over at our office, so please call and get your appointment scheduled so that you won't miss out when everyone's trying to use their insurance for the end of the year. So have a great day. Look forward to seeing you guys in the office, and happy post-Thanksgiving.